Hey guys, and welcome to sqadia.com. Today I'm going to be talking about different medical emergencies which may take place in a dental clinic. The dentist must be prepared to manage any medical emergency which may arise. We should be able to recognize and diagnose any medical emergency. Now, to manage a medical emergency taking place, we must have a dental emergency kit, which should be present at all times in a dental clinic. It includes 100% oxygen, which is used for inhalation, epinephrine 0.5 ml, nitroglycerin 0.4 mg, midazolam 10 mg, aspirin 300 mg, glucose and glucagon 1 mg, and an automated external defibrillator. We will look at all of these things in more detail later on in the video. First of all, we're going to be talking about the vasovagal syncope, also known as fainting. So this is the most common medical emergency which may arise. Basically, what happens is that there is inadequate cerebral perfusion, meaning that there is inadequate oxygen supply to the brain, which causes loss of consciousness. It is basically a reflex which is mediated by the autonomic nervous system, and it leads to widespread vasodilation. Now, what this vasodilation does is that it causes splanchnic and skeletal vessels to be vasodilated, and it leads to bradycardia, and the cerebral perfusion, the oxygen supply to the brain is diminished. Now, some of the predisposing factors include emotional stress, anxiety, fatigue, being tired when you reach the dental clinic, or a sudden change in posture or hypoxia, a drop in oxygen levels. The signs and symptoms include that the patient is going to feel lightheaded, fainting, or a slightly dizzy feeling. The patient may even be pale, sweating, and the pulse may be slow and thready. Patient may also experience slight nausea or even vomiting, and there may be eventual loss of consciousness. Now, how to manage such an emergency? The ABCDE protocol is very important, and it needs to be employed when diagnosing any medical emergency. So basically, the ABCDE approach requires the health workers, all health workers, to use their clinical judgment and their senses to diagnose and manage the patient effectively. So A stands for airway. A patent and clear airway is very important. Breathing. The patient should be breathing at around a rate of 12 to 25 breaths per minute. Anything more or less than that is abnormal. Circulation. Adequate oxygen supply should be available for the brain and the rest of the body. D stands for disability. We need to make sure and assess the level of consciousness of the patient. Exposure. We're going to look at signs of concerns which are present around a patient. Now, coming back to the management of the vasovagal syncope. So after following the ABCDE protocol, we're going to first of all position the patient. Now, positioning of the patient in a medical emergency taking place in a dental clinic is very, very important. So first of all, what you do is you're going to lay the patient flat and you're going to raise the legs. Next, we're going to make sure that there is patent airway. We can do that by slightly tilting the head and raising the chin. That's going to allow the patient to breathe effectively. We're going to loosen any tight clothing. After this, we're going to wait for the patient to recover. But if recovery does not occur within a few minutes, we're going to administer 10 liters of oxygen per minute. Usually the patient recovers, and when the patient regains consciousness, we're going to offer glucose in a glass of water or some sweet tea. And after that, we're going to reschedule the patient, and we're going to make sure that we counsel the patient for anxiety in the next upcoming appointments. Now we're going to talk about angina. Angina, also known as an acute chest pain episode. The pain of angina is usually described as a crushing or band-like tightness which may occur in the chest, and it usually radiates to the left arm or even upwards to the mandible. It can be accompanied by an increased heart rate or a feeling of nauseation. Now, how are we going to manage this? First of all, we're going to follow the ABCDE protocol, just like we discussed before. Then we're going to position the patient. We're going to sit the patient upright. We're going to give the patient Glycerin Trinitrate. Now, this is available in a spray form and sublingual tablets. In a spray form, it is available in 400 micrograms, so we give the patient 1 to 2 sprays. And the sublingual tablets are 0.5 mg. These are sublingual tablets, so they dissolve under the tongue and act very quickly. So what does this glyceryl trinitrate do? It is basically a vasodilating agent which causes relaxation of the vascular smooth muscles. When this happens, the blood supply is improved and eventually there is the relieving of symptoms and the patient goes into recovery. Now let's move on to myocardial infarction, or also known as a heart attack. Now this is caused by decreased or complete cessation of blood flow to the muscle of the heart, the myocardium. Now the signs and symptoms usually include severe and crushing chest pain similar to angina. It may radiate to the arm, the shoulders, and even to the mandible. Now there are going to be some additional features which occur so we can differentiate it from angina. So the skin becomes pale and clammy. There is shortness of breath. The pulse becomes weak and the patient may be even hypotensive. The patient may also experience nausea and vomiting. Let's move on to the management. We're going to carry out airway, breathing, circulation, disability, and exposure protocol. Then we're going to position the patient upright and we're going to relax the patient and reassure. Now, the next thing that we need to do is call the emergency helpline immediately. So an ambulance is on the way because we will need some additional medical help in dealing with a heart attack. In the meantime, we're going to administer glyceryl trinitrate 0.5 mg and we're going to give the patient 300 milligrams of aspirin. Now, what aspirin will do is it's going to prevent the progression from cardiac ischemia to cardiac injury and eventual infarction. It is also going to inhibit the platelet function, which is going to prevent clotting. Now, even after all of this, the patient becomes unresponsive. We need to start CPR without waiting for the medical emergency team to arrive. First of all, the dentist needs to check signs of life. So we're going to check the pulse and then we're going to hear for breathing. After this, we're going to start chest compressions. Now, these are done on the lower half of the sternum in the middle of the chest. The compressions must be at a depth of 5 centimeters, but not more than 6 centimeters, at a rate of 100 to 120 per minute. After around 30 compressions, the dentist needs to provide 2 rescue breaths. When the patient is going to regain consciousness, we're going to adopt a recovery position, which is a side-lying position. An automated external defibrillator may also be used if it is available in the dental clinic. Now, let's move on and talk about an anaphylactic reaction, also known as a hypersensitivity reaction. Anaphylaxis is a type 1 hypersensitivity reaction which involves the IgE antibodies. Basically, an allergen causes an increased release of IgE, which in turn causes a release of vasoactive peptides and histamine. Now, what these do is they cause bronchospasm, laryngeal edema, and vasodilation. Now, it is usually caused if the patient is allergic to penicillin or the latex rubber which is present in the surgical gloves. The signs and symptoms include stridor, wheezing, and hoarseness. This basically occurs because there is upper airway edema and bronchospasm. There also may be an itchy rash, erythema, facial flushing, or the patient may be even pale. This occurs due to the vasodilation of the blood vessels. Now, if this progresses and an intervention is not taking place, a respiratory arrest may occur, which may even lead to a cardiac arrest. Now, how to manage such a patient? First of all, the airway, breathing, circulation, disability, and exposure protocol. Then, we're going to position the patient upright and administer 0.5 ml of adrenaline intramuscularly. Now, what does this do? This basically causes a vasoconstrictor effect, which prevents or decreases the upper airway mucosal edema. Secondly, it has a bronchodilator effect as well, which helps in breathing. This is repeated at a 5-minute interval if no improvement is seen. Additional to this, airway and breathing needs to be managed, so we're going to administer 10 liters of oxygen per minute. And the patient usually recovers. Now let's talk about hypoglycemia, also known as low glucose levels. This is basically an abnormally low plasma glucose concentration of about less than 70 milligrams per deciliters. Now, a patient who has a history of diabetes, we need to take a thorough history and we need to assess the degree of diabetic control that the patient has. Now, if a hypoglycemic attack occurs, the signs and symptoms include trembling, headache, and cold sweats. The patient may also experience hunger, slurring of speech, aggression, or the opposite, confusion. Patient may also experience a sensation of pins and needles in the lips and the tongue. And if it worsens, seizures and unconsciousness may occur. Now let's move on and see how we're going to manage a situation like this. We're going to follow the ABCDE protocol. First of all, we're going to stop the procedure. Then we're going to lay the patient flat. Next, we're going to check the level of consciousness. If the patient is conscious, then we need to give oral glucose in the form of either 3 lumps of sugar or 2 to 4 teaspoons of sugar or glucogel, which is readily available. But if the patient is unconscious, we're going to administer 1 milligrams of glucagon intramuscularly or subcutaneously. Even after this, if the patient does not respond, we have to call the ambulance. Even after this, the patient is not responding to the glucagon. This is rare, and this means that the patient has exhausted the supply of the glycogen. The glycogen is basically converted by the liver into glucose, and the body uses that glucose in an emergency situation, like low glucose levels. In this case, we're going to administer 20 ml of intravenous glucose solution, and this needs to be done under supervision of a medical team. Epileptic seizures. Epilepsy is a neurological condition which causes unprovoked recurrent seizures. A seizure is a sudden rush of abnormal electrical activity in the brain. In a dental setting, a seizure may occur even due to an exposure to the dental light. Now, in a patient who has a history of epilepsy, we need to take thorough history, and that should include the nature of the seizures, frequency, and the degree of control of the disease. Now, let's look at the signs and symptoms which may occur during an epileptic seizure. First of all, the patient may have an aura or a premonition, a smell, or a feeling that the seizure is about to occur. First of all, there is a tonic phase. In this phase, there is loss of consciousness and the patient becomes rigid, falls, and may even become cyanosed. Then there is the clonic phase. In this, there are going to be jerking movements of the body and the tongue may be bitten. Now, it is important that we move all the dental instruments away from the patient to protect the patient from harm, and we do not need to restrict the patient's movements. Frothing at the mouth or even urinary incontinence may occur. Seizures gradually abates after a few minutes, but the patient may remain unconscious. If the seizures are prolonged, with active convulsions which are taking place for 5 minutes or more, this means that now the patient has entered the status epilepticus. In this situation, we need to administer oxygen and give the patient midazolam 10 mg via the buccal route or the intranasal route, whichever is more convenient. Midazolam is a benzodiazepine, which is a muscle relaxant. It has sedative effects. Now we're going to talk about choking and aspiration, foreign body aspiration. Now this is very important. This is basically due to the nature of the dental treatment, puts the patient at an increased risk of choking and aspirating different objects like dental instruments, rubber dam, files, mouth, sponges. All of these things can easily go beyond the level of the posterior fossas and may cause gagging, eventually leading to choking and aspiration. Careful suction of the oral cavity and closely observing the dental procedure is very important. Now, if there is a mild airway obstruction, the patient is going to be able to speak, cough, and breathe. The patient should also be able to respond to the question, "Are you choking?" to which the patient must nod or reply yes. But in case there is a severe airway obstruction, the patient will be unable to breathe and the breathing will sound wheezy. There will be inability to speak and the patient may eventually become unconscious. Now it is very important that we deal with this immediately. If the patient has suspected to aspirated a foreign body, we're going to allow the patient to cough vigorously so the airway is cleared out and the object is coughed up. In addition to that, we're going to follow the ABCDE protocol and we're going to position the patient upright. We're going to give back blows. So basically, back blows are delivered by the practitioner standing behind the patient and the chest is slightly supported with one hand and the patient is to be leaning forwards. 5 sharp blows are given between the shoulder blades with the heels of the other hand, as you can see in this picture. Now, if the back blows fail, meaning if the patient is still choking, then this means that there is severe obstruction and there may even be aspiration. Now, usually any object which has been aspirated moves to the right bronchus. This is because of the anatomy of the right bronchus, which is a continuation of the trachea. Now, in this case, we need to give 5 abdominal thrusts. Now, this is done by standing behind the patient and then we have to put both arms around the upper part of their abdomen, as we can see in this picture, and we're going to lean the patient slightly forwards. Then we're going to clench our fists and grasp with the other hand and pull sharply inwards, and we're going to give 5 abdominal thrusts. Once the patient has recovered and the object has been cuffed up, we're going to refer the patient for chest x-ray and bronchoscopy to make sure that the object has been cuffed up. So guys, this was everything about the medical emergencies. I hope you learned.